statewide measles cases in Kansas have now risen to 23. State health officials say that the outbreak there could be linked to the one ongoing in Texas, New Mexico, and Oklahoma that's infected at least 379 people. In both cases, unvaccinated children represent a majority of the cases. Now, this comes after comments by HHS Secretary Robert F. Kennedy Jr. in an interview this month. He's previously and wrongly linked the MMR vaccine to autism. In the interview, while he did say that the vaccines, quote, do prevent infection, he also downplayed their safety and said of their effectiveness, quote, for many people it wanes. There's no evidence it wanes in most cases. Then yesterday, Kevin Griffiths, the now former Director of Communications Office of the CDC, published a new editorial in the Washington Post about why he left the agency the previous week. At one point, he wrote, Kennedy has promoted unproven treatments for measles. He also suggested distributing vitamin A, which does not prevent measles. Meanwhile, my final weeks at the CDC, I watched as career infectious disease experts were tasked with spending precious hours searching medical literature in vain for data to support Kennedy's preferred treatments. I'm joined by Kevin Griffiths for this exclusive interview. Kevin, I appreciate you being with us. I do want to play some of what Secretary Kennedy said on to Sean Hannity that you referenced.
There are adverse events from the vaccine. It does cause deaths every year. It causes all the illnesses that measles itself causes, encephalitis and blindness, etc. And so people ought to be able to make that choice for themselves. And what we need to do is give them the best information, encourage them to vaccinate. The vaccine does stop the spread of the disease. Yeah, we're providing vitamin A.
Well, you said
which there are many studies, some showing 87% of effectiveness of vitamin A to help against serious disease and death.
I mean, there's a whole host of issues with what he said, as we just talked about. Why did you decide to leave your role at CDC? What was it about that interview?
Well, I mean, one of the fundamental things actually that Secretary Kennedy talked about there, which was that it's important for us to provide the best information to the American people. The problem is that's not Secretary Kennedy's strong suit. And so, a couple of different things that played into my decision to leave CDC. One, public health communications overall has really ground to almost a halt. It's certainly just a trickle compared to what it used to be. I mean, that's important because medical information changes all the time. And there's essentially a pipeline, a circuit of information that is happening all the time that goes from federal government, state, local government, all the way to providers. So having a halt of communication could have an impact on your.
Why are they not giving press conferences? Why are they not communicating?
Well, I think that's something that you would need to ask them. But I think one of the things that's clear is that the communications process, that public health works best when the folks who are experts are the ones who are saying, hey, this is something we need to communicate, and we need to communicate it now, and not relying on political appointees to make that decision.
We mentioned that in your op-ed you wrote about career infectious disease experts spending hours searching for data to try to support Kennedy's preferred measles treatment. You went on to say all this misdirection is a waste of federal dollars that will do nothing to control the outbreak. It could also cost lives. Do you think the country is prepared for this growing measles outbreak or another pandemic?
Well, what I know is that right now that the leadership at HHS isn't doing what it needs to do to do everything it can to control this problem. It is a complicated situation, and it's important that we spend all of our time thinking about what are the best ways to be able to interdict the situation and curb the outbreak. But instead of talking to the experts at CDC, Secretary Kennedy is talking to people on the ground who are I would say, of questionable reputations. And it's important that the folks at HHS, all the political appointees, are listening to career officials who are experts to be able to just get the best advice so that they can make the best decisions.
The CDC is also bracing for cuts. I mean, it could affect, we're told, as much as a third of the workforce. What kind of an impact would a third of cuts have?
Right. Well, I mean, I think that it's going to have an impact on its CDC's capabilities. I think you can kind of think of it the way you think about the military. In peacetime, there may not be a huge amount for the agency to do, but you're constantly preparing for what is next. And so what you want to be sure of is that you have the best capabilities, the best force ready to go when something, a situation escalates and you're needed. And if we have significant cuts to CDC, obviously that imperils that.
Kevin Griffiths, I appreciate your time tonight. Thank you very much.
Thank you so much for having me, Anderson.
Also breaking tonight.